So I'm Gregg Holman. I'm a registered nurse here at Sanford Health. I work in the Med-Surg behavioural health floor. I love what I do because you really get a chance to make a difference in people's lives. People are struggling. This past year has been particularly difficult for people. We've seen them in and out of the hospital. So having a chance to work with them at the bedside and help improve the quality of their lives is something that I really enjoy. I wanted to be a firefighter and my wife said no because she was worried I wouldn't come home. So I decided one time we visited South America. A friend of mine he owns and operates a clinic down there. And just seeing how nurses impact people's lives, like I don't think I ever fully appreciated the impact that they had on medical care until I saw it up close. And so that really got me thinking about a career path. Up until then I had different kind of jobs. I worked in high-rise window washing in Manhattan, I've worked in sales and marketing, I've done all sorts of things. But I think nursing really brought my personality out. I think with the candy store or the firefighting, you either want to bring people happiness or protect them. And I think nursing allows you to do both of those things. It helps you to improve people's lives, which makes them happy. And in many ways, you protect them by helping educate them on improving the quality of their care and their life. So registered nurses will provide most of the bedside care. So whether it's medications, monitoring vital signs for patients, getting them up and moving, that's a very important part of their care here. But also addressing their psychosocial needs. What will their needs be after discharge? Are we sending them back to just fail and come back again, or can we set them up for success? Can we set them up for programs in the community to help and prolong the care that we've done here in the hospital? So this is an acute phase of their care, but it's not the only phase. So we want to try and help them into the years coming. So for doctors, they'll drive a lot of the care, they'll tell us what they want us to do, but we're the ones who actually carry it out. We're like the contractor for the doctor. As far as my particular role, I work in admissions and discharges, so when patients come in, they're out of their element, they're uncomfortable or anxious. My role is to get them settled here, get their vital signs, explain what we do here, introduce them to their nurse, help them see what their care is going to look like in the coming days. Well, I think a community needs to know they have somewhere that they can go when they're in a crisis. That's the whole reason we're here. We're the ones who are trained to help a person navigate a crisis. We're not expecting people in the community to know how to care for themselves the way that they really should. Depending on your background, your upbringing, you may not have been raised with a culture that taught self-care. And so that's part of what we do here. It's not just the medication to keep your blood pressure under control, it's helping you understand why do you take this medication, why do you take it at the same time every day. Those kinds of things can just shape the person's life from when they leave so that they know why they're doing those things. We found that helping a person understand the rationale behind why they act helps to prolong that and kind of hardwire it, instead of just telling them you have to do this. No one likes to be told what to do, but if they feel like it's a choice and that they're benefiting from it personally, that's something that a hospital can help them to do, aside from the acute stuff like repairing a broken bone or something like that. I think you have to be patient. I think patience is very important. It's not just loving what you do. I think there's going to be the days when you're really challenged to the max of what you think you can handle. So being patient with the individuals you're dealing with, but also being patient with yourself. It's a learning curve. I think humility is important because we don't always know everything. You need to be able to learn, you need to be able to grow. And so learning from your colleagues, even ones who have been working less time than you have, they can teach you things. And you can grow as a person doing that.